you are not a candidate for liposuction. You are underweight, there is no fat to be removed. So there is no question of doing liposuction in such individuals. Between 18.5 and 25 are actually the best patients for liposuction. BMI or body mass index and liposuction. What is the connection? I am Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, and today we will talk about the correlation between BMI and liposuction. Now firstly, what is BMI? BMI stands for body mass index. It is equal to your weight in kilograms divided by your height in meters squared, and this gives you a number. This number is an indirect way of judging your health. It's not perfect. This number is not the end all be all. There are caveats associated with it. But as a rough number, it is a good way to tell whether your overall health is average, good or bad. So what are the various ranges of BMI? There are 4 main ranges. The first one is less than 18.5. If your BMI is less than 18.5, that means you are underweight. You need to put on some weight, you are a little too thin. Second range is from 18.5 to 25. This is a normal range and most people fall within this range. If your BMI is between 18.5 and 25, your overall weight is good. The third range is between 25 and 30. This is overweight. Here your weight is a little bit on the higher side. And the fourth range is greater than 30. If you are over 30, then you are obese and you really need to reduce your weight. Now having said that, like I said, this is not perfect. There are caveats. Someone might be between 18.5 and 25, they might be around 24, 25, but their fat content might be higher. So they would ideally need to lose some fat. Someone might be between 25 and 30, but they're actually quite fit because they're quite muscular and muscle is heavy. So your BMI might be falsely high. So it is not the end all be all, it needs to be interpreted. But overall, it is a good number to have a track of to see how healthy you are. Now, what is the correlation with liposuction? Liposuction is a surgery to remove the outer fat of the body. There is fat just below the skin and this fat is removed during liposuction by making small holes. This surgery is typically best for stubborn fat, which is difficult to get rid of. It's not a weight loss surgery. It is a body shaping surgery to remove those pockets of fat. When I say stubborn fat, this is the fat that is the last fat in your body to go. With your diet and exercise, it will take you a lot of diet and exercise to remove it because there are very few receptors to fat burning hormones in this fat. So most people with a regular day job simply do not have a time to do this level of diet and exercise to get rid of that fat. It is what you typically see in muscle men, bodybuilders, film actors, those kind of things. Now let us look at these BMI ranges and what it means for liposuction. Typically, if your BMI is less than 18.5, you are not a candidate for liposuction. You are underweight, there is no fat to be removed. So there is no question of doing liposuction in such individuals. Between 18.5 and 25 are actually the best patients for liposuction. This might seem counterintuitive. Wait a minute, you told me 18.5 to 25 is normal, so why are you doing liposuction in those patients? Their BMI might be normal, but like I said, there might be some small pockets of stubborn fat. They are otherwise fit and healthy. There are people who run half marathons who still have a little bit of fat on the sides, even though they're running half marathons. For them, liposuction is perfect because it's just a little bit of fat to get rid of and they look better and they feel better. Next range is between 25 and 30, those who are overweight. These are also good candidates for liposuction. These are patients in whom we do the liposuction to help them get back on their journey and kickstart and to get a healthier lifestyle. These patients we typically don't do very aggressive kind of six-pack creation liposuction. No, this is liposuction to help them along with their diet and exercise to help them get healthier. And the last group, more than 30, are usually not good candidates for liposuction. Because like I said, these patients need weight reduction. They are obese and liposuction is not a weight loss surgery. Having said that, there are some exceptions. In some cases, liposuction might be considered. The normal option for these patients is something called bariatric surgery. This is the best solution if they're not able to lose their weight on their own, but this is an invasive surgery which changes how your internal organs work and helps you lose fat that way. But some patients don't want such a large surgery. They feel that they can lose it, but they need a kickstart. So in them, we do some amount of liposuction to reduce the bulk. Their weight won't reduce much, but if you remove a lot of fat, they feel lighter, they're able to move better. And then that helps them work out in the gym and lose more fat and lose more weight. We have seen many patients wherein this initial liposuction has helped them kickstart their journey. Now, one thing you might have realized with all this is liposuction is only part of the solution. You have to maintain the results of liposuction with your lifestyle changes. That includes your diet and that includes your exercise. Remember, liposuction is not changing the way your body works. It is only removing that stubborn fat. If you're not careful and your intake is more and your output is less, that fat can come back. So it is part of the solution, it is not the entire solution. Overall, the best patients for liposuction are those who are motivated to have a better lifestyle. I hope this made sense and I hope this helps you understand if you're a good candidate for liposuction or not. Do get in touch with us, and if you have any doubts, leave them in the comments. Thank you. Have a great day.